Welcome on to our next video where we are talking about runner's knee, and in particular how strength training can assist in preventing and treating runner's knee. My name is Brad. I'm from CoachParry.com, where we help runners like you become fitter, faster and stronger. We're going to be joined by our strength and conditioning coach Shona Hendricks today, and we're also going to be talking about a strength training program that you can download right now for free. All you need to do is click on the link that's on the screen, and we'll be talking you through exactly what you should and shouldn't be doing in today's video. We're talking runner's knee on today's video. Shona, it's a very common running injury, and again, it's one of those things that with a bit of strength and conditioning and help over time, it's something that can be avoided. From a strength and conditioning point of view, what are some of the things you can do to prevent getting runner's knee?
Yeah, so runner's knee it's extremely common, and I guess the one good thing about it, and the reason I'm telling you this is because it's very easy to fix then with strength and conditioning is that it's not a structural thing. So it's not something where your ligaments or your bones are, really taking a lot of strain. That's normally surgical intervention is needed. It's something that we can fix with strength and conditioning and just a little bit of work, because that's allows for better muscle function. So really, what it is that there's a little bit of perhaps malalignment between your femur, so your thigh bone, and your lower limb, and where the patella, your kneecap, moves in that area. And what is happening is that if there's a little bit of weakness, that patella or your kneecap is sliding over the bones, and that's really what's causing the pain. So from a strength and conditioning point of view, if you can get that strength right, so that malalignment between it isn't happening, that's going to solve a lot of problems, and that is really, really easy to do.
What are some of the things you can do to strengthen that area so that you do fix that misalignment?
So it's mostly a weakness within the posterior chain. So and this is becoming a very common theme in all of these injuries. So really just basic strength and conditioning in this area is key. So strengthening the glutes and the hips and the pelvic stability, lots and lots of hamstring work. Most of the runners I work with have really, really poor hamstring strength. And what tends to happen is that if you strengthen that hip girdle or that pelvic stability, the hips tend to externally rotate outwards. And what happens if they internally rotate, your knee will start having that sort of like conking in effect, and that is also putting a lot of strength, pain in the knee. So hip, I would definitely recommend glutes, hamstrings, and again, a lot of the inner thigh abductor sort of work is vital for this.
Shona, is it necessary to head to a gym, or is body weight stuff good enough to start with to fix this?
Yeah, I mean, I would recommend starting with body weight rather than going all in with some weights and that at the gym. The problem with someone who is experiencing pain with runner's knee is they'll tend to experience pain in the most basic exercises, such as squats and lunges, and that's the thing that we really are our go-to exercises. So because of the mechanism of how this injury is working, we try and avoid that sort of work. So definitely if someone's doing that with weights, they're just going to exacerbate their problem. So generally you'll probably start feeling a bit of pain with a lot of step downs or step ups, because that's really where that sliding of the patella is happening. So basic body weight stuff, which you'll probably find when you're doing glutes exercises, and that it's more lying down on the ground, isometrically, just starting to get those muscles working before we can actually start building on that strength.
You mentioned the pain with step ups and step downs. That's obviously one of the dangers, is you don't want to be doing anything that's going to make it worse from a strength and conditioning perspective. So often I'm guessing you want to do this in conjunction, if you do have an acute case, in conjunction with a medical practitioner.
Yeah, definitely. I mean, that's first and foremost. If you're feeling this pain, we use the term runner's knee, but and I'm speaking about essentially patellofemoral, sort of syndrome, where that's sliding across. But it could be so many things. The knee is such a complicated joint that if you're getting that pain, go to a physio or a doctor and get that diagnosed first, because then the treatment from there will be key. So that is the first step. Always go and get that diagnosed, and then these exercises are so easy to do, and if you're not experiencing pain with doing those exercises, then yes, they're probably going to benefit you in the long run.
And that's one of those things too. I mean, runner's knee can come on pretty much at any stage, but if you do have a pretty strong biomechanic system, and you can strengthen that over time by doing strength training, you can avoid any potential issues down the line.
Yeah, no, that's why we do it. That's why I have a job. So let's keep it that way because, we're trying to make sure that people are doing the preventative and the pre-ab exercises so we can avoid all of that. I'm trying to put the physios and the doctors out of business and keep all the business for myself. So, let's make sure that we're getting strong enough to sustain the loads of running. Running is so compounding, and it's that constant, on the knee taking just so much pressure and essentially the entire body weight. If anything that's not working well or in sort of sync with each other, that's above or below the knee, that knee is just going to carry all of that sort of compounding effects. And for the guys who are running extremely long distances, this is really where this takes effect. And so just get stronger. Do some stuff with it at home or in the gym once or twice a week. 30 to 45 minutes is a great start. And it'll really benefit you in the long run, because once you've got that base, you can just continue to build on it. And then from there, your strength work starts becoming less of a prehab thing and more of something that's going to actually help your performance.
Yeah, absolutely. And we've spoken about it so often with the running coaches, with Lindsay, with Marcus, is the key to running well is consistency. And one of the big sort of puzzle pieces in staying consistent is staying injury-free. So these things work really well together, that if you can stay injury-free, you're going to run better, and the strength obviously helps you do that.
Yeah, that's the key. And so we use the same sort of philosophy or principle. The consistency with your strength work is key, because then you're going to just build on that. And yes, if you can avoid days where you're sitting for 2 or 3 days out with a niggle, and you can run, because really we're here to run. We're not trying to look, well, everyone is trying to look good on the beach, but, our goals are running based. And the strength work is there to complement that and to ensure that you're staying on the road and you're niggle free. Secondary to that, we don't want those niggles to turn into chronic injuries. And that's really what we're trying to do with the strength and conditioning.
Thanks for joining us on this video. Don't forget, if you don't want to miss any of these videos that we put out, hit the subscribe button over here. You can catch our latest video over here, and one of our most popular is over here. And also, if you want to shave 10 minutes off your PB, all you need to do is download our free strength training program. You can get that right here.